Guys, have you heard of this brain natriuretic peptide? Actually, this is not made by brain, it's made by heart. So that you should know. It is BNP, brain natriuretic peptide. Okay, so why is it called brain? Because it was first found in pig's brain or something they have identified there. Okay, so let me explain this. It was originally identified in extracts of porcine brain. Okay, so I'm going back there. Natri is what? Sodium something. Uretic, water, the diuresis kind of thing. Peptide. Protein is made by peptide, correct? Peptide becomes protein. So you understood, right? So what is brain natriuretic peptide or BNP? BNP is a hormone made by the heart. Okay, brain natriuretic peptide. Okay, and it is usually made by the heart when the heart is stretched. So you understood, it is going to help in diagnosis of something. So when the heart stretches, it is producing these natriuretic peptides. So you have ANP, that is atrial natriuretic peptide, which comes from the atrial myocytes, and BNP, which is brain natriuretic peptide, which actually comes from the ventricles. Okay, I think it is from the left ventricle mainly they are saying. So both of these have diuretic properties. So that is the name. That is why the name is natriuretic peptide extra. So just know that this is 32 amino acid peptide, okay, the brain natriuretic peptide. In this video, we are looking at what? BNP. So it is actually how it is made. Let me zoom this a little. The left ventricle is going to make 108 amino acid prohormone. That is broken into 32 amino acid BNP, which is active. Then you have the inactive NT-pro-BNP, that is 76 amino acid N-terminal fragment. N-terminal is an important word that they are using that everywhere. And so the 76 plus 32 is 108. Yes, it is. So basically in the lab test now, mainly they are detecting this N-terminal fragment, okay. Even this active one you can detect, both also they can detect. Mainly N-terminal one, that is the pro-BNP, N-terminal fragment, pro-BNP. Inactive, this one only they are trying to detect in the blood tests, okay. So basically, whenever the cardiomyocytes stretch, like in heart failure, or if there is some LV dysfunction, that time only this will be elevated, okay. Actually, BNP they are using as a cardiobiomarker, not ANP, because BNP has a significantly longer half-life, okay. So that is why they are using this usually to diagnose heart failure, or mainly actually to monitor volume status in established heart failure, because this is not very specific like we told you. So normally what cardio biomarkers do you use? We have heard of tropi a lot, right? The hospitals, you would have done tropi a lot. So just remember one more thing, brain natriuretic peptide, though this one is not from the brain, okay? So this one, what are they going to check? The pro-BNP, that is the inactive N-terminal one. This one they are measuring more, okay? So it's a simple blood test, around 2,000, 3,000 rupees it is costing. And it will show that if there's any LV dysfunction, and to just see the prognosis and response to therapy, they can do this, okay? Like I told you, it is not very specific. If it is above 500 means they're taking it as a serious thing, okay? Normally it is below 100, they are saying, in this age range. So this is coming as almost like a card test in the lab. So like I told you, 500 picogram per ml, okay? Above 500 only, they are saying it is something to important. Other cardiobiomarkers, I told you, troponin, right? Tropa you would have heard a lot in your hospital. Anyways, in this video, we want to look at what? BNP, that is brain natriuretic peptide. So one more thing you should know here, this neprilysin, this enzyme can break down this ANP, BNP, okay? So just remember that. So now let us go into the BNP, actually what it does, okay? So it is going to affect the blood vessels. It's going to do vasodilation. So it's going to reduce the blood pressure. It is also going to work on the kidneys and do diuresis. This, I think in the beginning itself we told you. What does it cause? Diuresis. So this person will lose lot of water, urination, right? So basically, how is this going to work? People, that you should know. It is not going to allow sodium to be absorbed by the body. So sodium is going out of the body, water will follow, okay? So basically sodium reabsorption is inhibited, remember. Now look at this diagram here. Sodium, where is it? Here, ANP, BNP is here. See here, ANP, BNP, okay? So what it is, they have put a negative sign here. So it is going to neurohumoral negative sign they have put. Okay. So it is going to cause what? Diuresis. Okay. Then these natriuretic peptides have direct effect on kidneys to increase the excretion of salt and water. So therefore, what they are doing, the blood volume will reduce. So the load on the heart will reduce. So it is trying to protect the heart. That is what it is trying to indirectly do. So did you understand brain natriuretic peptides? So what and all did you look at in this video? It is actually made by the heart. It is a hormone made by the heart along with that atrial natriuretic peptide. It will actually be released by the ventricle when there is stretching of the ventricle, and it will cause the uresis, that is loss of water, okay, from the body. Sodium and water will be lost. So it is actually trying to have a protective action on the heart. It will also cause vasodilation, okay, the blood pressure will reduce.